I'm Pat Stone. I'm the director of the Center for Health Policy and the Centennial Professor of Health Policy here at Columbia School of Nursing. I'm very excited to welcome you to our event, Understanding the Federal Budget Process and its Importance in Policy Making. Today's talk is the first in the three-part series of Health Policy 101, our virtual series that the Center for Health Policy is hosting. Through this series, we hope to support our community in better understanding the policy process. Today, we're going to hear from Ross Former, the Vice President for Government Affairs at Columbia University Irving Medical Center. Ross represents the medical center on legislative and executive branch matters at the federal, state, and local levels. He's also a lecturer at the School of Nursing and at Mailman School of Public Health. Prior to coming to Columbia University, Ross spent 5 years working for the former state Senator Daniel Patrick Moynihan, and as state director in the New York City office and regional director of the upstate office in Oneonta, New York?
Oneonta. Oneonta.
Oneonta. Okay.
Oneonta. You got to say it quickly.
Yeah. Before joining Senator Moynihan's staff, Ross held several legislative and government positions, including legislative assistant and counsel to Congressman James Schurer, and legislative assistant to Congresswoman Mary Kaptur, legislative counsel to New York State Office of Federal Affairs, and legislative director to New York Midwest Senate Coalition. In addition to his work in the government, he was the New York political director for the Bradley presidential campaign in 2000, a disaster assistant employee with the Federal Emergency Management Agency, FEMA, and a member of Senator Hillary Rodham Clinton's and Senator Kristen Gillibrand's Military Academy Selection Panel. And I found out the other day, we've both been at Columbia about 24 years. So
Yep.
Anyway, here it is, Ross, and looking forward to hearing what you say.
Thanks, Pat. You know, I've been using that bio for a long time, and I just realized that the word disaster appears right after my experience as the political director for the Bradley for President campaign. That is purely coincidental, but perhaps a bit of a metaphor. You may recall, we didn't win. So thank you for having me here today. I'm going to talk a little about the federal budget process because it is my belief that if you want to understand policy, you need to understand budget policy because so many decisions, so many outcomes are in fact dependent on the budget, especially at the federal level. A couple of notes in my presentation. I use different sources of data for different things. And as such, when you use different sources, there may be slightly different methodologies, slightly different time frames. So some of my numbers may not match up 100%. Don't get caught up on the actual numbers themselves. The numbers are there just to illustrate a concept. There may also be one or two slides which may seem a little out of date. I should probably update them. But again, I think while the numbers maybe have to be updated, the concepts are still the same. So why is it so important to study the budget? It's often been said that a budget is a moral document. It reflects the values and the priorities of the government, what we should be spending money on, what we should not be spending money on. And that budget reflects those opinions with the vision, if you will, of the government. But that's actually not what we're going to talk about here today. We're not going to talk about what those priorities should be. What we're going to talk about today is a more technical aspect of budgeting. We're going to go look into definitions, how the process works, who's involved, the timing, and perhaps more importantly, look at some of what the numbers are. So I have some slides, which I am going to attempt to pull up. And let me see if I can get this started. Can everybody see my slides?
Yes, but Ross, you are showing your next slide note.
Display mode. So I'm going to swap.
Yeah, perfect.
Is that better? Okay, great. Well, here we go. That's me. So some of the budget basics. Let's start with this. One is the federal government works on what they call an October 1st fiscal year. So the fiscal year actually begins October 1st prior to the actual year. So FY25 did not begin January 1st, 2025. It began October 1st, 2024. And as such, FY25 will end on September 30th, 2025. Interestingly, New York State's budget fiscal year begins April 1st. New York City's budget begins July 1st. Columbia's budget begins July 1st. The actual year begins January 1st. My wife's birthday is December 31st. So I tend to be busy every 3 months. Now, if there's one concept I hope you will take from this lecture, something I hope you'll understand, it's the difference between mandatory spending and discretionary spending, because I think this is key to understanding how the federal budget works. Another word you'll see used for mandatory spending is entitlement spending. But for reasons I can't really figure out, entitlements has become a dirty word. People yell at me when I use it, so I'm going to call it mandatory spending. So what's the difference between the two? Mandatory spending is formula driven. You decide you want to achieve a certain goal. You want to spend money on a certain thing and cover a certain amount of cover a certain group, and you enact law that allows you to do that. That is controlling. Now, and you spend money as long as the criteria is met. You set up criteria, situations where you're going to have to spend the money. And as long as the criteria is met, as long as you're in those situations, you spend money. Now, you can predict how much it's going to cost. You can have actuaries, you can have accountants, economists, but that's not controlling. What's controlling is the need, the idea of what qualifies in those criteria. Discretionary spending is sort of the opposite. You have a goal that you want to spend. You decide, okay, I'm going to devote X numbers of dollars to it. You set that money aside. And once you run out of that money, you cannot spend any more, even if there is additional need. Now, you can try to get more money, but until you do, that's it. There's nothing left. You have to stop spending. So with mandatory spending, the program, if you will, controls. With discretionary spending, the allotted amount controls. Now, there's been a little bit of a blurring of the line in recent years, but essentially, mandatory programs tend to be part of permanent law. They're enacted and they stay in law until somebody either amends them or repeals them. Discretionary spending, on the other hand, is year by year. You appropriate a certain amount of money for it each year, and when the year is done, you either have to appropriate new money or you don't get to spend anymore. It's done on an annual basis, whereas mandatory, even if you do nothing, you still have to continue spending in the fiscal year. In discretionary spending, if you do nothing, you have to stop spending. So can anybody give me an example of some mandatory programs? You didn't know there was going to be Q&A.
Feel free to say in the chat or if you want. Social Security.
Okay, who said Social Security? That is correct. Yes, Social Security is a mandatory program. We have set up a system in this country where while you're working, ages, depending on, let's say, minimum of 14, all the way up to 65 and above, if you work, you are paying FICA each month. That goes into a pot. And if you qualify for Social Security, i.e. you have turned, let's call it 67, there's still a bit of a formula going on, and you have worked 40 quarters throughout your career, you are entitled to Social Security. Now, the federal government can plan how much it's going to cost, and they can budget how much that's going to cost, but that's not what controls. They have to pay the Social Security payments. It's mandatory. The people are entitled to the Social Security payments every month. Social Security is predictable. We can predict how many people are going to turn 67 or 66 and change. It's working its way up to 67. We can get a pretty good idea of what those people earned over the course of their lifetime. And we also can get, some basic actuary planning on how many people over 67 are going to die in the next year, and that'll determine how much Social Security we have to pay, the government has to pay over the year. But if for whatever reason those calculations are wrong and the death rate among 90-year-olds is abnormally low, lower than expected in a year, the federal government will have to spend more on Social Security because more 90-year-olds are living. And that's the law. The law is if you're entitled to Social Security, you get it no matter what. Any other entitlement programs? Any guesses?
Medicare?
Medicare, that is correct. Again, likewise, if you are 65 or older or disabled and meet certain other criteria, and you have paid into the Social Security system, to the Medicare system for a certain number of years, I think it's also 40 quarters, but don't quote me on that, you are entitled to Medicare. You are entitled to the government pay for a portion of your healthcare, a significant portion of your healthcare. Now, Medicare is actually much more difficult to predict than Social Security. Yes, we know how many seniors there are likely to be in the upcoming year, but it's much harder to predict how healthy are they going to be, how sick they're going to be, what type of medical needs they will be. And the federal government, again, has to pay those costs no matter what. Now, the federal government can change the rules. They can decide we're now going to cover 30 days of temporary care versus nursing care versus 20 days. But again, until they do that, they have to cover all the costs associated with a senior citizen's health care. There's one more big one.
Medicaid.
Yes, Medicaid, exactly. Low-income Americans are entitled by law, under certain circumstances, to have part or all of the health care covered by the federal government. Now, as you know, Medicare and Medicaid, while the same goal, covering portions of the population with health insurance that were not able to get health insurance in the past, they are very different programs. Medicare is completely run by the federal government. Medicaid is a partnership between the federal government and the state government. Now, interestingly enough, states are not required to join Medicaid. All 50 of them do, but it's actually a state choice. And it wasn't actually, I just learned this recently. Medicaid was created in 1965 or 66, I forget which, 65, I think. It wasn't until 1982 that all 50 states chose to cover Medicaid. Likewise, in Medicaid, the states have much more latitude, flexibility as to what they want to cover and what they don't want to cover. There are certain benefits that are mandatory if you want to be in Medicaid. You don't have to be in Medicaid, but if you're in Medicaid, you have to cover pediatrics. You have no choice. Other things like adult dental care, states are not required to cover that. New York State does. I don't know the others, but I don't believe a lot of other states do cover adult dental under their Medicaid program. So there are some other mandatory programs, but Social Security, Medicare, and Medicaid are sort of the big three. The other one is some veterans benefits, federal employee pensions. Thankfully, I spent some time in my career working for the federal government. I am entitled to a pension, a very small pension, but a pension nonetheless. There are some Department of Education programs, some transportation programs, but essentially Medicare, and Medicaid are the big mandatory programs. Sometimes interest on the debt is referred to as a mandatory program. I would argue it is. The federal government basically has to pay the interest on its debt. The federal government has never defaulted on its debt. Sometimes that's referred to in a category in and of itself and not part of mandatory programs. Now, examples of discretionary programs. Any thoughts? Well, the answer is essentially everything else. Whether it's agricultural programs or some are mandatory, NIH, job training programs, transportation programs, it's all discretionary. Those are appropriate on an annual year-to-year basis. Now, I will compliment this group because one of the most, when I teach this class, and I teach this subject in classes or give talks such as this, one of the most common misconceptions that I hear or people say is that the Defense Department is mandatory programs. Defense Department is not. It's a discretionary program. Now, obviously, the federal government has an obligation to provide for the common defense for the country, but they do so on an annual basis. There's nothing sort of written into law, if you will, that says this will be the federal budget no matter what. There's an annual defense appropriations bill. Oh, here we go. Come on. Why are we stuck? Oh, we got to do this. Okay. Oh, here we go. Okay. Defense versus non-defense. In the appropriations process, which is the process for discretionary spending, the federal government has created what they call firewalls. It is difficult, not impossible, but it's more difficult to move money from defense to non-defense and from non-defense to defense than it is within those categories. So it is easier to take money from the Army and give it to the Air Force than it is to take money from the Navy and give it to the Department of Labor. Likewise, it is easier to take money from Health and Human Service, from the CDC, and give it to HRSA than it is to take money from the Department of Education and give it to the Marine Corps. There are these firewalls set up. There's these procedural hurdles that keep the money within these basic categories. This is a great example of the phrase that say the phrase, where you stand depends on where you sit. The reason we have these firewalls is that because in the 1980s, President Reagan was raiding non-defense programs in order to pay for the military buildup to fight the Cold War against the Soviet Union. And Democrats in Congress kept getting frustrated by it. At one point in time, they had the votes to do so, so they erected these firewalls that protected non-defense spending in the budget, made it much more difficult for President Reagan and then President Bush to take money from non-defense programs and put it towards the Pentagon. Well, fast forward just 4 years, 1993, A, Bill Clinton is president, and B, the Soviet Union has fallen. The Berlin Wall has collapsed. There's a different philosophy in government, and arguably, I'm not a foreign policy expert, a defense expert, but the needs are very different after the fall of the Soviet Union. Those same Democrats who erected the firewalls that prevented the government from taking non-defense money and moving to defense were now frustrated by the same rules when they wanted to move money from the Pentagon to non-defense programs. Capital versus operations. And I put this down there, but in the federal government, it doesn't exist. Very often in state budgets, in company budgets, and frankly in our own personal budgets, we distinguish between capital spending and operational spending. Things we spend on each year versus big one-time or few-time projects. I imagine most of us can't afford a house based on what we earn in a single year. On the other hand, we can take a mortgage and pay for it over time. That's a capital expense. Yet we can afford our food, hopefully, our rent, other annual payments. That's an operational expense. State governments will have separate operations capital budget. The federal government does not. They don't separate it like that the way many local governments do. There's also something called budget authority versus outlays. This is just having to do the time of when you spend it. The time you get the money versus the time you spend it can be up to 3 years, frankly. So you may get money devoted towards a project in FY25, but especially it's a building project, you may not spend it until FY26, FY27, etc. So federal money can last for up to 3 years without a reappropriation, without a reauthorization. So just look a little bit at the timeline. So where does the budget start? It starts with the agency input. It starts with the agriculture, transportation, veterans affairs, all deciding what's the money, what are their priorities, what do they want to spend money on during the following year. Now, this takes place over the summer, the year before the fiscal year. So again, this summer is 2025. They will be starting to put together the budget, believe it or not, for FY27. Not FY26. That work has already started. It's over the summer, you will start to see agencies start working on the FY27 budget. Then the introduction. Now, the agency input is all sort of behind closed doors. Those are just discussions, internal discussions, formal, informal, putting together a plan to ultimately result in the introduction of the president's budget. That is the first official act, the presidential budget request. Now, normally, this would take place on the first Monday in February, preceding the beginning of the fiscal year. So FY26 should begin October 1st. That means the budget would be introduced. FY26, 2025, that means the budget should be introduced whatever the first Monday in February is, let's call it February 4th, just for guessing, of 2026. However, as in 2025, when you have a new president, that process is delayed. So we actually have not seen President Trump's budget request for FY26 yet. It's also delayed for another reason, and we'll get into that later, but they didn't finish FY25 on time, so it's tough to do FY26. We haven't finished FY25. I suspect we will see at least part of the president's budget request in late April, early May. It may come in two parts. It's often referred to as the skinny budget because they sort of tackle big picture items first, and then they get into the details later. So the president introduces the budget in February. In a normal year, and I can remind you again, this is not a normal year, but there would be budget hearings. The budget committee in the House and the Senate, as well as all the committees of varied jurisdiction. And the agency heads, the secretaries, the administrators would come and testify before Congress about the president's budget requests, what the priorities are, what the new spending initiatives should be, what the old spending initiatives that we should no longer spend money on, what taxes should be lowered, what taxes should be raised, et cetera, et cetera. And the president has to explain those initiatives to Congress, to the budget committees, to both Republicans and Democrats, to both parties. Some of those budget hearings can get a little testy, if you will. So they have the budget committee hearings, and then the budget committees put together what is known as a budget resolution. Now, the budget resolution is not a law. It is an internal document to Congress. It is a sort of a 10,000-foot blueprint of what the budget should look like. It does not drill down into specific programs. It just decides we should spend X number of hundreds of billion dollars in education versus Y hundreds of billion dollars on road repair, et cetera, et cetera. It is a very high level document. Again, it does not get into sort of program by program. Because it is just a congressional document, the president, this budget resolution actually never goes to the president. It is an internal congressional document only. Now, it does not mean it is not important. It's actually very important because while it is the sort of the outline, it is the starting point. It is, again, the blueprint for all the rest of the discussions as they drill down, as they move forward. Then we get into a process which is quite complicated, and you may have heard or read about recently, called budget reconciliation. Now, budget reconciliation does not have to be done each year. In fact, very often it's not done, but is used fairly often as a way to achieve major goals of the president or congressional majority. Why does one use budget reconciliation? Congress has rules, especially the Senate, but the House too, but especially the Senate has rules, lots of rules. One of those rules that govern debate. You can debate this. You can't just, there's no free and flowing open debate, especially in the House. It's very limited debate. In the Senate, though, you have something called unlimited debate, which means before you can pass a bill, you actually have to end debate. And in order to do so, you actually have to agree to end debate, or you have to overcome what is known as a filibuster. A filibuster basically is an unlimited debate. And in order to overcome a filibuster, you don't need a majority. you actually need 60 votes. And also, by the way, you don't need 60, you don't need 60% of the votes. You need actual 60. So for whatever reason, a couple of members of the Senate are absent and 60% becomes 58 votes instead of 60 votes. You still need 60 votes in order to overcome a filibuster and end debate. It leads to some very interesting discussions and way of doing debate, some of which we saw play out recently. Now, there are two types of filibusters. One is sort of a group or a procedural filibuster, where, again, you won't get to start debate, you can't pass a bill until you overcome that 50% barrier and invoke cloture to end a filibuster. That is very difficult. It happens, but it is very rare that a Senate majority has 60 votes. It's happened only once in the last 25 years or so, and that even didn't last very long. There's a second type of filibuster, which doesn't get used very often, but when it does get used, it's kind of fun, and that's the individual filibuster. And the rules of the Senate says that if a senator has the floor and continues to stand and talk, they can maintain that floor. He or she can maintain that floor indefinitely. Debate will continue as long as that senator is talking and standing. You may have seen that about 3 weeks ago, Senator Cory Booker of New Jersey, in an effort to bring attention to some policies of the Trump administration that he did not approve of, got up on the Senate floor and talked and stood for over 25 hours. That beat the old record, which was held by Senator Strom Thurmond in 1957, who got up and spoke for just over 24 hours. Those of us who study these things are actually quite happy that Senator Booker did this, not because we agree with him or disagree with him, but because Senator Thurmond was famous for, among other things, filibustering to prevent a civil rights bill passed. So now we have filibuster used for a different purpose. Now, the question that everybody asks, and I knew the story for Senator Thurmond, I checked it for Senator Booker, are you allowed to go to the bathroom? Are you allowed a break to go to the bathroom? The answer is no. If you leave the floor to go to the bathroom, you give up the floor and the filibuster ends. With Senator Thurmond, he purposely dehydrated himself by going into a sauna before his filibuster. I just read that Senator Booker didn't eat for 3 days, didn't drink for 24 hours. All the things that I imagine from a healthcare point of view, a lot of the folks on this call, healthcare professionals, may not recommend to patients. But he did it. Senator Thurmond did it. Senator Booker did it, and they were able to speak for that long. So why am I telling you all this? Because budget reconciliation is a special process where you can avoid all that, where you have limited debate in the Senate and you can pass a bill with a simple majority. Now, why wouldn't you, if that's true, why wouldn't you use the budget? If you're the majority party and you have 55 votes and you can never get to 60, why wouldn't you use budget reconciliation all the time? Well, there are limits on that. One is there can really only be, depending on how you count it and what happens the previous year, let's say 2 to 3 filibusters per fiscal year. You can't, reconciliations. You can't do a reconciliation on every bill. That's just not allowed. Second, under something called the Byrd Rule, you can only use budget reconciliation for things that affect the budget. Your bill must have a significant effect on the federal budget. If it does not, you cannot use budget reconciliation. You have to go through regular order, and that involves the filibuster. So, for instance, I don't care how pro-life you are. I don't care how pro-choice you are. You could not use reconciliation to pass a reproductive health bill or a bill restricting abortion, because unless you can make an argument, and that's a little bit strained, frankly, that this would have a significant effect on the federal budget, you can't use budget reconciliation, and the parliamentarian will strike it down for you. For discretionary programs, let's say budget reconciliation is generally used for mandatory programs and tax policy. For discretionary programs, there's something called the appropriations process. It's an annual process each year, and that's how we determine the the annual appropriations bills, and those are subject to a filibuster. And if all goes well, you'll have enactment. You'll pass budget bills, and those bills will be signed into law. I should also mention that because budget reconciliation is legislation, it does have to be signed by the president. That is actual legislation. So who are the key players? Well, obviously the president. It is the presidential budget request. It reflects the president's vision, the goal, the priorities of the administration. The Office of Management and Budget. Now, I would argue, for the political geeks here, the government geeks in the room, the director of the Office of Management and Budget is arguably the second or third most powerful person in the executive branch. And that depends on the relationship. It's obviously the president, but when you get second, third, and fourth are usually the chief of staff, the vice president, and the director of OMB, not necessarily in that order. Now, in the Trump administration, we have a new player, the DOJ director, which is something that is new. So let's call it the top five, not the top four. And we could argue about where the OMB director fits in that order. But the OMB director plays a very important role. Under President Trump, it's Russell Vought. He was President Trump's OMB director during the first term as well. Now, why is OMB so important? Well, two reasons. OMB, the staff at OMB, they write the first draft of the presidential budget request. All the agencies submit their requests, their policy, their what they want to do for additional programs, cut certain programs. All that gets funneled in to the OMB, and it's the OMB staff who put pen to paper, if you will. And while there can be lots of changes and edits and input going down the line, as you know from just if you've ever written a paper with a lot of people involved, if you're the first draft, if you're the sort of the lead author, if you will, or even not the first in terms of reporting, but the first in terms of timelining, you get to put your imprint on it in a way that others do not. So that's it. The other thing about OMB is that all regulations, once they're determined by the agency, have to be approved by OMB before they can go into effect. So OMB is actually a gatekeeper for all executive branch regulations. The Congressional Budget Office. Up until about 50 years ago, Congress simply relied on the president for the numbers, the estimates, the projections, whatnot. During the Nixon administration, Congress grew to distrust the president, and they created there's something called the Congressional Budget Act, which basically gave Congress its own expertise by creating the CBO. And the Congress will take the president's budget and wipe out all the assumptions and make their own assumptions and their own calculations and their own forecasts. It's, again, another group, used to be called pejoratively probably the green eye shade crowd, accountants, actuaries, economists, attorneys, that type of thing. They do their own calculations. CBO also has a very important role in all pieces of legislation because they're the one who determines how much a bill is going to cost. You often hear the phrase, "What's this?" Especially when we're debating healthcare reform, the phrase that we say the most often is, "What was the CBO score? How much was this new benefit going to cost? How much was this new tax going to raise?" That was up. They relied on the expert opinion of CBO, so the CBO score mattered tremendously. There are two committees which play an important role. One we talked about is the Budget Committee. The second is the Finance/Ways and Means. For whatever reason, most committees in the House and Senate have the same names, but for whatever reasons, Finance is the name of the committee in the Senate. In the House, it's called Ways and Means. You already talked about the Budget Committee. They sort of start the process. Finance and Ways and Means have a jurisdiction over tax issues. They have jurisdiction over trade issues. And they also have jurisdiction over Medicare and some portions of Medicaid. So the old expression, to Willie Sutton, why do you rob banks? That's where the money is. Why do you want to be on finance? Why do you want to be on Ways and Means? That's where the money is. That's where, if you're a member of those committees, you're having a larger role in the budget process than many others. Again, just by way of reference, currently right now, the House Budget Chair is Jody Arrington of Texas. The Senate Budget Chair is Lindsey Graham of South Carolina. These are all Republicans. They have a majority in both House. The House Ways and Means Committee Chair is Jason Smith of Missouri, and the House Finance Committee Chair is Mike Crapo of Idaho. The Cardinals, the Appropriations Cardinals. Now, we talk about the appropriations process. The Appropriations Committee is also a very powerful committee because it's in charge of discretionary spending. And the Appropriations Committee has 12 subcommittees. The chairs of those subcommittees are referred nicknames as the Cardinals because they rule over those domains. Those domains may be small, they may be large, but if you're the chair of Appropriations Committee, you exercise a significant amount of control over what goes on, over the spending decisions for that particular subject matter area. I will note that unlike the church, there have been plenty, and there are women cardinals currently, right now. And then leadership, and this is a development more recently. The Speaker of the House, the Majority Leader, will come in and sort of finish the process. All this stuff I've talked about before, they handle the low-hanging fruit, but very difficult decisions, very difficult issues, those will get resolved by leadership. They'll sort of bring everybody to the table and force a compromise or get something that'll work that can get all the votes to pass. So we've talked about the process. We've talked about who's in charge. Let's actually look at some numbers. So let's look at FY25, and PBR stands for Presidential Budget Request. Now, this is actually, believe it or not, still President Biden's budget. We have not gotten the FY26 budget yet. I suspect if we were talking roughly a month from now, I'd have to come up with a new slide. But right now, the FY25 PBR is the most recent budget document we have. The projection is $5.49 trillion in revenue, spending $7.27 trillion in spending. You don't need to be a math major. You see that spending is greater than revenue, so you're going to have a deficit of $1.78 trillion. Now, that's a lot of money. But I said, don't focus on that figure. Focus on the figure to the right. The deficit as a percentage of gross domestic product. That is what economists will tell you, I think, is the more important figure, is the more telling figure about the size of the deficit and what it means to our economy. And so pay attention. You see that the FY is 6.1%. The projected budget, the deficit is 6.1% for FY25. And that's just a projection. That's not an actual real number. Let's look back at some previous numbers. The Biden years, you can see that it's fairly stable, although it creeped up slightly in FY24. And by the way, these are final numbers. These are actual numbers. We have completed FY24. That is in the books. The deficit was 6.4% of GDP, and in 24 and 23, 6.3%. So fairly constant. And again, FY25 projected to decrease slightly this year under the Biden budget. That may not be the final number, especially since we have a chance in the administration, but the projection was 6.1%. Look at the COVID years. COVID was expensive. Okay, revenue was down, spending was up. In FY21, 12.3% of GDP. FY20, nearly 15% of GDP. The budget deficit was that high, over $3 trillion. Over a $3 trillion budget deficit. Again, by comparison, these are the Trump pre-COVID years, first term, fairly low, 3.5 and 3.9%, lower than it is today. You could argue there's still some COVID effects on the budget, but a much lower number, slightly more than half of what it is now. And just the final comparison, I'll tell you the Obama years, even lower. In the last couple of years of the Obama administration, a very low budget deficit, at least in comparison to the overall economy. So let's take a longer look. This is the budget deficit, again, as a percentage of GDP over the last 125 years. What is the biggest cause of budget deficits? Anybody guess?
War?
War, absolutely. Okay, the largest budget deficit in history, over 20 29% was World War II. The second largest, 17%, World War I. Third largest is actually COVID. Fourth largest was the economic crisis of 2008, 2009. Then you can see things like the Great Depression and some of the recessions during the 1980s. What's also interesting about this slide, you can see how rarely over the last 125 years we've had a budget surplus and how little that surplus has been over the years. We have spent, I'm going to take a guess here, 98% of our time over the last 125 years in deficit, which is why we have, I don't have this slide, but you see our debt is, several $trillion at this point, $1 trillion, and approaching 100% of GDP, I believe. But you can see we had a budget deficit in the Roaring '20s. Following the war, it looks like for a day and a half in the 1950s, we had a budget surplus, another day and a half in the 60s. And then our last surplus was actually the later years of the Clinton administration and the early years of the Bush administration. But once we had a combination of the Bush tax cuts and 9/11, we went back in to deficit. So that's the deficit. Where does the money come from? Again, I caution these slides come from a little bit of a different sources, so some of the numbers may seem a little bit not 100% lining up, but again, just the concepts. And you can see that 84% of the federal revenue essentially comes from you and me. The taxes we can pay, or our employers, the payroll taxes and the individual income taxes. Some pay more, some pay less, but together we all pay roughly 84%. Corporate income taxes, relatively low, especially compared to other developed countries. Excise taxes, sin taxes, alcohol, cigarettes, some firearms, that type of thing. What's also interesting, look at customs and duties. This is 2024, 2%. If you were to show you, if this chart, if they could do PowerPoint, the founding fathers could do PowerPoint, and look at this draft around the year 1800, customs and duties probably would have been 80 to 90% of the federal revenue. That basically was the only source of federal revenue for the first 150 years of this country. It was in the I'm going to say 1916. I could be off by a year. I think it was the 16th Amendment. Again, I could be off by that. I'll check it in a second. Income tax. We didn't have an income tax prior to that. It was unconstitutional. Now we have an income tax. And then during the New Deal, we have the payroll tax. They now make up 84%. There's been a lot of talk about tariffs. What's interesting to me about tariffs, we've always had trade policy, trade discussions, even trade disputes, and sometimes trade wars. But it's been a trade policy debate. President Trump is added a new dimension to it. It's not just a trade policy discussion, it's a fiscal revenue and revenue discussion. He actually sees customs and duties as a revenue raiser for the federal government, as a way to pay for the federal government, as a way, frankly, possibly to reduce other forms of revenue. That is something that we have not seen in a long, long time, especially have not seen it from Republicans who, and this is obviously a generalization, generally tend to be free, have tended prior to this administration of Trump 1, free traders. But President Trump sees it not only as a trade policy, but as a fiscal policy. So that's where the money comes from. Where does it go? I talked about mandatory spending. Mandatory spending is 2/3 of the federal budget. If I were to show you this pie chart 50 years ago, it would have been flipped. Discretionary would have been 2/3, mandatory roughly 1/3. That is one of the stories of federal budgeting over the last 50 years, is the explosion in the cost of mandatory programs. Social Security, in 1970, Medicare and Medicaid was fairly young, fairly new program. They're no longer a program. We have several generations of people who qualified for Medicare and Medicare Social Security. It's a part of our lives. And you can see now it's 2/3 of the budget. And mandatory programs tend to be very popular and very difficult politically to make changes to or to repeal, for that matter. Just, what those mandatory programs, you can see that Social Security, unemployment, and then Medicare, Medicaid make up a large portion of them. Education, some military, some housing, some transportation, some science, energy, environment, et cetera, et cetera. But for the most part, Social Security, unemployment, Medicare and health, really Social Security, Medicare, and Medicaid, those are the largest source of mandatory spending. Look at discretionary spending. And you can see that the military is roughly, and this varies from year to year, but let's call it 45% of discretionary spending. And that's a lot of money. But I keep reminding you, this is 45% of 33%. So somewhere around 17% of the federal budget goes towards defense spending. I can't tell you how many people say, "Oh, we cut the military, we solve our defense, we solve our budget problems." Cutting the military could be a good idea, it could be a bad idea as a policy matter. You're not going to solve the budget deficit with cuts to the military. You may make a dent, but I can tell you, you could turn the military budget, and this varies a little bit from year to year. You can make the military budget zero, and we would still have a budget deficit. The flip side of that, ideologically, you see international affairs. I can't tell you how many times I've had people tell me, "Oh, we got to cut foreign affairs. We're spending too much money on foreign aid. If we could just cut foreign aid, we'd make a dent in that budget." Again, foreign aid could be a good idea, could be a bad idea, discussed amongst yourselves. It is not sound budget policy to try to cut foreign aid. It's about 3%, I think, of discretionary spending. So it's about 1% of overall spending. So we only have a couple of minutes left, so I'm just going to do one more slide, and then I'll adjourn for some questions. And I will admit we didn't get to everything here today, but something called tax expenditures. That is a phrase used to describe money that the federal government chooses not to collect. Money they could collect if they wanted to, but they make a policy decision, they make a change in the tax code that we are not going to collect that. We think that by doing so, we achieve a societal goal. And you can see the tax expenditures cost the government a significant amount of money. If we did not have tax expenditures, we'd have almost $2 trillion more in spending, and it's just coincidence. That would be about what we would need to zero out the budget deficit. Any guesses at what some of the major tax expenditures might be?
I don't know, Ross. I really don't.
Okay. I can tell you that, I'll give you a hint. Good chance a lot of people on this phone call are benefiting from them. Columbia pays a portion of our health insurance, right?
Oh, benefits.
Okay. And also the portion that we pay with pre-tax dollars, correct?
Yeah, sure.
Okay.
Yes.
That is the government has chosen to do that, to allow us that benefit, to encourage us to purchase health insurance. Anybody own a home, have a mortgage? Okay. Your interest payments are deductible. Okay. That is revenue the federal government has chosen to forego because they think home ownership, again, you can agree with this or disagree with this, is a good societal goal. Charitable deductions. We want to encourage charity. So we reduce the cost of it, depending which tax bracket you're in. Pensions. We want people in their senior citizens, in their senior years, to have money. So we have tax deferment on pensions. And the other big one, which is now smaller than it used to be, is state and local taxes. We don't think it's fair to pay taxes on taxes. That has been capped. There's discussion of raising that cap, but for the most part, it is still a tax expenditure. So with that, I'm going to stop here because I want to respect people's time. And we have a couple of minutes, and I can stay for a little bit longer if folks want to. If you have any questions, discussions, things you think I got wrong, things you think I should add, et cetera, et cetera, et cetera.
If you want to come off video and ask questions, we have a small group, so please feel free to. Any questions, thoughts, things that did not get answered?
I always say with this. Okay, yeah, good. I got a question.
Why don't I just I only due to whatever work related meeting, so I only caught the later part of your talk. Excellent talk, because I guess it's really in the whatever frontline newspaper and everything. Everybody concerned about the U.S. federal budget and spending. So, do you think the current administration, they're on the right direction on doing the tax cut? Because we do the math. Actually, it's not decrease the debt deficit. Is kind of.
So I'm not going to give an answer to that question because I'm not here to give you my views of the world. I will say this, they have a huge challenge in front of them if they think they're going to be able to achieve their goals in terms of tax cuts, maintaining the Trump tax cuts, and also reducing or maintaining the budget without exploding it. Especially for political reasons, they've talked about keeping Medicare off the table. They've talked about keeping Medicaid off the table. I can guarantee you they don't want to put Social Security on the table. Social Security has sort of been called the third rail of politics. You touch it, you die. They are trying to find a way to achieve these savings and to pay for the tax cuts and to reduce the deficit without touching those. And I think I hope the point that you got is that if you take Medicare off the table, you take Medicaid off the table, you take Social Security off the table, you don't got a lot left on that table. Now they're leaving themselves a little bit of wiggle room by they're saying they'll be able to attract waste, fraud, and abuse. They're going to go after waste, fraud, and abuse. They don't define what waste, fraud, and abuse is. One person's waste, fraud, and abuse could be, inefficiency. One person's waste, fraud, and abuse could be a bad policy decision. But what I will say is this, if they are going to achieve their goals, and I don't know if they are or not, and politically they have a very difficult road ahead of them, and again, whether you think that's good or bad, it's going to be difficult. I don't see how they're going to do that without touching Medicare and Medicaid. I don't think they'll touch Social Security, but I just don't see how they get from point A to point B without doing that.
Well, we are at the top of the hour, so thank you, Ross, so
okay,
much.
For those who want, I actually can stay on for a couple extra minutes. I don't know if we're going to lose the Zoom or not, but if not, you know how to get in touch with me. Please feel free to let me know if you have any follow-up questions.
Yeah, I do have a 5 o'clock appointment, so I'm going to have to get off. But I want to really thank everybody that could join us. And those of you that'll be watching via recording, because we had a little snafu, a technical snafu. I hope you enjoyed it. I want to say to be on the lookout for more information about our second installment of our Health Policy 101 series, where Dr. Monica O'Reilly Jacob will be giving an overview of the U.S. healthcare system, so the policies around that. And
a simple topic.
A simple topic, all in an hour. You'll get an overview of the healthcare system.
I thought I had a lot to do in an hour.
But we're looking forward to that, and then we'll be having the third one at the end. So thank you all. I'm going to go to my 5 o'clock meeting. Ross, thank you, and stay on.